Hi, my name is Dr. Jopar. I'm here to talk to you today about varicose veins. Varicose veins is a common problem. We see them in about 50% of women and about 30% of men. And they basically come in two forms. You have the spider veins that you see in the skin that are more aesthetic, that people come oftentimes for consultation how to get rid of them. And then you have the bigger bulging kind that can be more of a medical problem and more symptomatic. It's interesting to know that varicose veins it's a uniquely human problem. And why? It's because we are the only animals that walk upright. And it basically comes from the blood having to flow up from the feet towards your heart against gravity. So the body has to guide the blood upwards by the muscles in the legs that are contracting, that pushes the blood up. But in the veins, there has to be valves that block it from going back down. So it goes up gradually towards the larger veins, and then it flows up to the heart. If the valves in some of the veins are defective, then the blood will not be stopped and it will keep going down. And that's what we call flow reversal. And the blood tends to flow down instead of up, again, because of gravity. So that's what then eventually dilates the veins and causes varicose veins. This is why often when someone initially presents with varicose veins, we do a diagnostic test, which could be a Doppler or a duplex type of ultrasound, to have a look at the veins, either in the standing position or if someone's lying down and coughing, to see if the blood is flowing the opposite way. So depending on the type of varicose veins you have, that will decide the treatment. Just to review the anatomy a little bit, in the legs there are the deep veins, which include the femoral vein and the superficial femoral vein and the popliteal vein. And then there's also the superficial system, which is the saphenous veins, either the greater saphenous vein, which runs all the way from your ankle up to your groin, or the lesser saphenous vein, which is on the outside part of your ankle that goes to the back of the knee. But by far the most common cause of varicose veins is the greater saphenous veins, in which the valves don't work, like I mentioned before. So if the duplex confirms that the valves don't work, then basically three types of treatments for those kinds of varicose veins. There's the oldest treatment, which is the surgery. It's called the varicose vein, saphenous vein stripping, where we make an incision in the groin and at the knee, and we actually remove the the saphenous vein. And also then we do multiple counter incisions to actually remove the varicose veins also. The second treatment, that's a newer treatment, is called endovenous laser ablation, in which the saphenous vein is destroyed by a laser, which is inserted with a small incision at the knee and guided up into the thigh, up to the groin, and the saphenous vein is destroyed. And then the other varicose veins are then injected after. And then some people, we can also do what's called ultrasound guided sclerotherapy into the saphenous vein directly, where using an ultrasound, we find the saphenous vein and inject a strong sclerosant to try to sclerose the vein, which means essentially cause an inflammation in the vein and eventually a thrombus that then eventually blocks the vein completely, and there's no more blood flowing through it. So those are the three main modalities of treatment for the larger saphenous vein. For the smaller spider veins, of which there are also multiple types, there's what's called the spider vein, which looks like a spider. Then you can have the linear one, or you can have like a branched one where it looks like a branch with smaller veins beside it. Or sometimes it's just called punctate, where it's just a little small dot that appears as a red spot. For those types of veins, generally it's injections that we do. That's an office procedure that we do by injecting a milder sclerosant into those veins. As I alluded to, these sclerosants work by creating an inflammation in the walls of the vein, and then sometimes a small clot, which then fibroses over and blocks the vein. And the only reason that we see those veins is because there's blood flowing through it. So once there's no more blood flowing through it, you don't see them anymore, even though the veins stay there. And these treatments, and generally work well, but they're not permanent. These veins often recanalize, and So they need a maintenance treatment to prevent them from coming back. One of the causes of the smaller veins is it's not 100% clear what causes them. It's often hereditary in families. Multiple traumas to the leg, like more violent sports, too much sun exposure, too much cortisone cream, multiple pregnancies, working, standing up all the time. Those are often the major causes for these veins. So, in conclusion, the more aesthetic varicose veins are easily treatable with an office procedure with injections, and the bigger ones need either surgery or laser treatment as an effective treatment. Thank you very much. I'll be posting more videos shortly.